Hello guys, a warm welcome to this week's edition of Brain Gist. I'm Dr. John Oluwole, a specialist neurologist, and today I'll be talking to you guys about headache during sexual intercourse. Every now and then I see young patients, usually young, walking into the clinics, both males and females, complaining about headache occurring during sexual intercourse. So that's what we're talking about today. So first of all, I'd like to welcome you back to the channel and thank you for watching all the time, for your support, comments. And for first-time viewers, you're very welcome. This is Brain Gist, where I offer education for free on brain disorders and all the things you need to know about the brain and its disorders and how best to live with them and what you should do in certain situations. So I encourage you to subscribe and turn on your notification bell so that when I release videos, you will be one of the first people to see it. So these headaches are not uncommon. Every once in a while, I see young patients walking into the clinic and complaining about this kind of headaches. They're usually very intense headache, very explosive headache with sudden onset, tending to happen as the individual approaches orgasm, or sometimes even at a peak of orgasm itself. And such individual would have to abandon the activity and rest, and sometimes the headache lingers on, albeit at a lower level, probably for several minutes or run into hours, and sometimes persists for days. So why do people have these kinds of headaches during intimacy? Well, I would say there are probably two categories of such kinds of headaches. There are those individuals that have got a primary sex headache form, in which there is no underlying disease. And there are those individuals who've got a secondary form of the disease or a secondary form of a headache, sex headache, in which there's an underlying disease. And there are usually two things that we look out for in these individuals that must be found if present and treated. One of them is what we call brain aneurysms. Aneurysms are like balloon-like swellings of the arteries within the head and or brain. And when those abnormal balloon-like swellings are present, they can potentially rupture or burst and cause bleeding into the brain or head and have catastrophic outcomes, and that's why they must be detected if present. And the second category of things we want to exclude is the presence of a tumor in the back part of the head, inside, just where the tail of the brain is. So if there's a tumor sitting in there, that can cause this kind of symptom. Or some individuals are born with crowded space in that area, what people call Chiari malformation. So if that area is crowded in a way that it generates pressure, that can cause these kinds of symptoms. So there are special scans or head scans that we do to look for these two possibilities. We do a special scan dedicated to study arteries of the head to look for those swellings, those abnormal balloon-like swellings, because of potentially disastrous consequences can happen if they are undetected and there's a rupture or burst. And then we scan the head as well to look for any tumor or crowding in the back part of the head. And if those are found, those would need to be treated quickly for the headaches to resolve and for the individual to be able to resume their usual activities. And in the vast majority of people, we don't find anything. In up to 90% or even more, we don't find any of these two disorders, and such individuals are said to have primary sex headaches, and there are medications we give to them to help to prevent those headaches from occurring, and so they can live their normal lives. So I thank you so much for watching today. I believe you learned something, and if you did, why don't you like the video, share the video, give your comments, and of course I invite you to subscribe so you can benefit from all future videos, and of course do turn on your notification. So thanks once again for watching. Thanks for all of your support, and I'll see you in my next video. And until then, stay safe and goodbye.